Hey everyone, I'm Brandon Irwin. I'm from Manhattan, Kansas. I'm sitting here with my pals. I have something to ask of you. We have something to ask of you. In the next 48 hours, I want you to spend 5 minutes to tell us your story about healthcare, how healthcare cuts are going to impact you and your family. Okay, so let me tell you what's going on here. Our team is going to Washington, D.C. this Tuesday on July 18th, and we're going to sit in Senator Moran's office and tell him why he shouldn't vote for the new healthcare bill. One of the only ways that we can tell him not to do this is to share with him your stories. So we need you to tell us your stories. So how can you do that? Well, we're going to make it really easy for you. The first thing you can do is pull out this little thing, your phone, and record a 60-second video of yourself telling us how the loss of healthcare insurance, or healthcare coverage, is going to impact you and your family. And then post it to our Facebook page. The Facebook page is Living and Dying in Kansas. And I'm going to include a link to that right below here. So that's one way that you can do that. Just pull it out, hold it right in front of your face, and tell us your story. The other way you can do that, that you can tell us your story, is to click on the link to the Google Doc that we're going to include below, and you can write it. You can write us your story and tell us how the loss of health insurance or coverage is going to impact you and your family. Okay. There's also a third way. You don't have to post this video that you're going to record on our page. You can actually send it to us in a private message as well. Okay. So, what should you tell us in this story? Well, just think about a couple of things. You don't even have to know all of the details of this bill. Tell us how a loss of health insurance and coverage would impact you and your family, and consider things like, what would it look like if you didn't have health insurance? And especially if you are poor, or younger, or older. Okay, those are the people who this healthcare bill is going to impact the most. You could also consider, if you have a pre-existing condition, what would it be like if your health insurance didn't cover that? Okay. You could also consider, lastly here, how an increase in premiums would impact you and your family. If you had to spend more of your income on health insurance premiums, how is that going to impact you and your family? Okay. If you're going to record a video, keep it under 60 seconds. Okay, we don't need a dissertation here. If you're going to write it, okay, in that Google Doc, you go nuts. You can go, tell us all you want. Okay. So tell us your story. The other thing that you can do and should do is help us get stories from other people. And you can do this in at least two ways. One is to simply share this post and this link with your friends and your family and tell them to do the same thing. And number two, you could connect with some of your friends and other people in your family, and especially people who don't have aren't technologically savvy, and help them record their own story and do the same thing. And again, this is going to be really easy for you. Just record it and post it to our Facebook page. The link is right below. Okay, Facebook makes it really easy for you to do this now. Why should you do this? Okay, in the next week or so, the U.S. Senate is going to vote on this new healthcare bill. It's called the Better Care Reconciliation Act. Okay, by and large, this is a public health disaster. This is not a good bill for almost anybody in Kansas, unless you're wealthy. We're traveling to Washington, D.C. on Tuesday the 18th to sit in Senator Moran's office as a form of civil disobedience, and we want to be able to tell him why he shouldn't vote for this bill. Okay, we need your stories to do this. Okay, so again, what we need you to do is tell us your story through video, private message, or through our Google Doc, how this is going to impact you and your family, and to share this link with your friends. Okay. Any questions, please let us know, but we really hope to hear from you. And keep in mind, we need to hear from you soon. Like, we're going on Tuesday. You have 48 hours to get us this. So please make haste. Thanks.